तो स्वागत है जी एक बार फिर आप सब ਦਾ ਅੱਜ ਦੇ ਇਸ ਹੈਲਥ ਸੈਗਮੈਂਟ ਵਿੱਚ ਸਾਡੇ ਕੋਲ ਦੰਦਾਂ ਦੀ ਕਿਵੇਂ ਚੰਗੇ ਤਰੀਕੇ ਨਾਲ ਸੰਭਾਲ ਕਰਨੀ ਉਸ ਬਾਰੇ ਆ ਕੇ ਡਾਕਟਰ ਅਲੀ ਕਨਾਨੀ ਜਿਹੜੇ ਕਿ ਇੱਕ ਸਪੈਸ਼ਲਾਈਜ਼ਡ ਆਰਥੋਡੋਂਟਿਸਟ ਹਨ ਆ ਕੇ ਸਾਂਝ ਪਾਇਆ ਕਰਦੇ ਨੇ ਅਤੇ ਇਹਨਾਂ ਦਾ ਇਹੀ ਮਕਸਦ ਹੁੰਦਾ ਹੈ ਕਿ ਸਾਨੂੰ ਸਮਝ ਆਵੇ ਕਿ ਸਾਡੇ ਜਿਹੜੇ ਦੰਦ ਨੇ ਉਹਨਾਂ ਦੀ ਕਿਵੇਂ ਅਸੀਂ ਦੇਖਭਾਲ ਸਹੀ ਰੱਖਣੀ ਹੈ। ਆਓ ਅੱਜ ਅਸੀਂ ਗੱਲਬਾਤ ਕਰਦੇ ਹਾਂ ਅੰਡਰਬਾਈਟ। ਜਿਸ ਤਰ੍ਹਾਂ ਅਸੀਂ ਓਵਰਬਾਈਟ ਦੇ ਬਾਰੇ ਪਿਛਲੇ ਕੁਝ ਸਮੇਂ ਦੇ ਵਿੱਚ ਗੱਲਬਾਤ ਕੀਤੀ ਸੀ ਕਿ ਓਵਰਬਾਈਟ ਹੁੰਦੀ ਹੈ ਜਦੋਂ ਸਾਡੇ ਜੌਜ਼ ਅਪਰ ਜੌ ਜਿਹੜਾ ਬਾਹਰ ਆ ਜਾਂਦਾ ਹੈ। ਅੰਡਰਬਾਈਟ ਕੀ ਹੈ, ਇਸ ਦੀਆਂ ਕਿਵੇਂ ਰੈਕਟੀਫਿਕੇਸ਼ਨ ਹੋ ਸਕਦੀ ਹੈ ਤੇ ਕਿਹੜੀਆਂ ਪ੍ਰੋਬਲਮਸ ਫੇਸ ਕਰਦੇ ਨੇ ਜਿਹੜੇ ਲੋਕਾਂ ਨੂੰ ਅੰਡਰਬਾਈਟ ਹੈ। ਆਓ ਜਾਣਕਾਰੀ ਲੈਣੇ ਡਾਕਟਰ ਅਲੀ ਕਨਾਨੀ ਤੋਂ। Welcome to the program, doctor.
Thank you, Hardeep.
Most welcome.
It's good to be
so
back.
Today we are going to talk about underbite. Now, what is basically underbite and why does this develop?
Underbites are is a dental and or jaw relationship problem.
Okay.
And it can be caused by two major things.
Okay.
You either have a situation where the lower jaw is too far forward from the upper jaw, or the upper jaw is too far back from the lower jaw.
Right.
The lower jaw might be in the correct spot, but the upper jaw is too far back. That's from a jaw relationship standpoint.
Right.
From a tooth relationship standpoint, it's a matter of the lower teeth perhaps being too far forward, or the upper teeth perhaps being too far back.
Right.
Okay. The result, when you look at it, will look very similar.
Right.
It will look like this. This is an underbite.
Okay. So like we talked about overbites, in which you said that thumb sucking is one of the major reasons. In this underbite, how does this develop? Is this just on genetics or your lifestyle also?
In North America, the prevalence of underbites is about 5%.
Wow. Okay.
Yes. Okay. So this is one of the least common, but one of the most difficult to correct.
Right.
In Asia, for example, underbites are 15% according to the literature.
Right.
So they're more common in Asians.
Okay.
Okay. And less common in North America.
So any particular reason for that?
The most common reason is genetics.
Oh.
Yes, hereditary.
Right.
It is very, very difficult to stop somebody that has it in their genetic makeup.
Right.
That is going to be growing in an underbite fashion.
Okay.
Very difficult to stop this.
Right.
Yes.
So what problems arise for a person who is having an underbite?
There's many different types of problems. First problem, of course, would be aesthetics.
Okay.
Right? It's very unnatural to have your lower teeth in front of your upper teeth.
Right.
I think it can cause some self-confidence issues. Second thing would be, I think the bite in general is very uncomfortable. Most people are used to using these upper and lower front teeth together to chew.
Right.
You can't do that when your teeth are so far separated.
Of course. Yeah.
Right?
Yeah.
Third thing would be there is some literature that alludes to the fact that there can be some jaw joint problems up here.
Okay.
Yes. Some jaw joint pain, discomfort.
Right.
There can also be some unusual wear on the teeth. The teeth start breaking down faster.
Right.
Patients with these types of problems generally have very strong bites. They bite very hard.
Right.
And the biting very hard in combination with this, of course, cannot be healthy.
That's right.
Yes.
So what are the correctional measures now these days which are available, and as an orthodontist, what kind of treatments can be given to the patient?
There are 3 or 4 things that an orthodontist can do to address this.
Okay.
And again, it depends on what age you're able to catch this happening. Okay.
Now, before you answer this, when you say before at what age you are able to capture this, so this means basically when you are small, and what are the telltale signs that now you are going to have underbite? Is it at that young age only can you see with your naked eyes that you are having a problem, or only with passing of age you can see that?
Harpreet, you'll be surprised. My son is 2.5 years old, and he sometimes likes to posture his jaw like this.
Okay.
He has some signs.
Right.
So yes, you can see it.
So the sooner you see it, and better it is that you bring him to a orthodontist.
Yes. Now at age 2, of course, is too young.
Of course, it's too small. Yeah.
But I'll tell you, the medical literature supports that you want to have a child at least seen and potentially intercept in what's called the early mixed dentition.
Right.
That means you don't have almost any adult teeth. Everything is still baby.
Okay.
That is still when you want to attempt this.
Right.
Why? You want to attempt it. You want to attempt a correction when a child is young, because everything is still more malleable.
That's right.
the jaws have not yet finished developing, and they have not yet set in stone their final position.
Right.
Age 6 and age 7 are very common ages to intercept if you see this.
Okay.
And at that age, you will see this.
Okay.
Absolutely. A child that has this, you will know right away.
Right.
Yes, you can tell.
Let's now talk about the correctional measures which you adopt, which are the 3-4 treatments available.
Okay. If a child has an underbite, and the key word is they're still young, then there's a couple things you can do.
Okay.
The one that seems to be the most predictable, the one that seems to have the best prognosis, the greatest chance of working, is using something called a reverse pull headgear.
Okay, reverse pull headgear.
Yes, it goes by another name. It's called face frame.
Okay.
Now, I have an example of one here.
Right.
This is a face frame.
Okay.
Okay, and it's worn like this.
Right.
Okay. Now, I'm not the best model, but what the video is going to show you is when a child wears this face frame, it is connected to another appliance that is connecting the upper jaw.
Right.
And you can see in the video that there are orthodontic rubber bands that connect to little metal hooks on the upper jaw to this apparatus.
Right.
And effectively pull the upper jaw forward.
Okay.
And it's pulling the upper jaw forward, and all the pressure is coming to the forehead and the chin.
Okay.
So the forehead and the chin act as an anchor to pull and advance the upper jaw forward.
Right. So for how long you have to wear these?
This type of treatment, believe it or not, this can take up to 1 year.
Okay.
Yes, this is not
short. So regularly you have to wear it and then it corrects it.
You have to wear this about 20 hours a day.
Oh my God.
Yes. And in patients that are embarrassed to wear it to school, we ask for every minute outside of school.
Right.
You can take it out to eat.
Okay.
Of course, take it out to brush, but you should wear it when you're in the evenings, when you're sleeping. This is a very, very compliance-dependent appliance.
Okay.
If you don't wear it enough,
well, that's not going to
that's
have
with
a
everything.
Right.
You're not going to get the desired
result. So what's
result.
the next treatment which is available these days, apart from this?
Sure. The next treatment would be in sort of the 11, 12, 13, 14-year-old age group.
Right.
That would be braces, okay? Just like braces can correct overbites, braces can correct underbites, braces can correct crooked teeth.
Right.
Braces usually intermix with a whole bunch of things.
Right.
It's what do you add to the braces to fix more difficult things.
Right.
You could add the face frame to braces.
Okay.
Okay. So you might have to use braces in combination with that face frame appliance in the video. Okay. You might have to use braces in combination with taking out some teeth.
Okay.
Okay. This next video is very interesting. It shows how if you take out 2 lower teeth in a patient that has a very significant underbite, you can then use the space created by taking, for example, 1 tooth here and 1 tooth here, and bring these bottom front teeth backwards into that space.
Okay.
Does that make sense?
Yeah.
So you go from here to there.
Right.
You're not moving the jaw, you're moving the teeth within the jaw.
Okay.
The jaw might still look prominent, but you can hide the fact that you have an underbite by moving the teeth within the jaw backwards, so you end up with a positive relationship.
Okay. Now, while this treatment is going on, what kind of precautions should be taken? Like, because what you said about using these braces and using this face thing, so what kind of precautions should be taken by a patient at that time?
Of course, regular checkups by your orthodontist.
Right.
Yes, these visits are every 4 weeks or 6 weeks or 8 weeks, and there's always changes being made, and you're under the guidance of a doctor, so that's all.
Okay, and towards the end also, there's another treatment called two-phase orthodontic treatment. What is that? Two-phase
orthodontic treatment is a special phrase for that identifies treatment that is going to be perhaps too complicated, so that it's done in 2 phases.
Right.
A younger phase, which maybe lasts about a year, and that's the type of stuff that we've been talking about.
Right.
The face frame, the early correction of an overbite, the early correction of an underbite. You can spend about 1 year and fix the jaw problem when they're young.
Right.
When they're older, then they spend 1 more year, approximately, in braces.
Okay.
So you get the jaw problems out of the way when they're young.
Right.
Get the jaws set up to allow maximum chance for the teeth to come in.
Right.
Correct all the underlying genetic type stuff, and then worry about the final touches on straightening the teeth when you're older.
Okay.
Patients that have not had two-phase orthodontics, many of these patients, especially in very severe situations, like large underbites or large overbites, they need corrective jaw surgery.
Okay.
That is the third or fourth way that you can correct an underbite.
Great.
The jaws can be broken.
Okay.
Reset the jaws.
Okay. And in the coming programs, we'll talk in details about these. Thank you very much for your time. It was a pleasure having you. Thanks.
Thank you, Harpreet.
ਅੱਜ ਇਸ ਵਿਸ਼ੇ ਤੇ ਅਸੀਂ ਗੱਲਬਾਤ ਕੀਤੀ ਹੈ ਜੀ ਅੰਡਰਬਾਈਟ ਦੀ। ਇਹ ਤਦ ਹੁੰਦੀ ਹੈ ਜਦੋਂ ਕਿ ਜਿਹੜਾ ਥਲੜਾ ਜੌ ਹੈਗਾ ਉਹ ਜਿਹੜਾ ਠੀਕ ਨਹੀਂ ਹੁੰਦਾ ਹੈਗਾ, ਤੇ ਇਸ ਵਾਸਤੇ ਜਿਸ ਤਰ੍ਹਾਂ ਡਾਕਟਰ ਸਾਹਿਬ ਨੇ ਜਿਹੜੀ ਲੇਮਨ ਲੈਂਗੁਏਜ ਵਿੱਚ ਗੱਲਬਾਤ ਕੀਤੀ ਹੈ ਕਿ ਬਹੁਤ ਸਾਰੇ ਕਰੈਕਸ਼ਨਲ ਮੈਜਰਸ ਅੱਜ ਅਵੇਲੇਬਲ ਹੈਗੇ ਨੇ, ਅਤੇ ਇਹਨਾਂ ਦਾ ਸਹਿਯੋਗ ਲੈ ਕੇ, ਇਹਨਾਂ ਦਾ ਬੈਨੀਫਿਟ ਲੈ ਕੇ ਤੁਸੀਂ ਆਪਣੇ ਦੰਦਾਂ ਦੀ ਸਹੀ ਜਿਹੜੀ ਟੀਥ ਦੀ ਕਰੈਕਸ਼ਨ ਹੈ ਉਹ ਕਰਵਾ ਸਕਦੇ ਹੋ।